Thanks for joining us again here on Health Call Live. So happy to have you part of the program. We're going to begin today with a problem that affects 1 out of every 4 Americans, and that's something called varicose veins. Now, you may think of that predominantly as a cosmetic issue, but then that indicates that you don't have this problem, because if you did, you'd understand there can be a lot of pain and discomfort and other issues that go along with varicose veins. More than just unsightly, it is a big problem for many people. The itching and the pain that goes along with having this issue is something that is addressed by our guest today. He is Dr. Marcus Jimenez, the physician behind the Indiana Vein and Laser Center, with offices in Fort Wayne and also in Fishers, Indiana. Good morning.
Good morning, Lee.
You were a cardiac surgeon before you started down this path, and you told me something very interesting about patients and what they appreciate between the two, between a life-saving procedure and having their veins corrected.
Well, I mean, it is interesting in that when you have a life-threatening illness that's acute, you are, focused on getting that taken care of. But once it's taken care of, you go on with your life. When you have problems with your veins, varicose veins that are causing you ongoing discomfort and even disability, it really is amazing how dramatically different your life becomes, and how grateful those patients are when they come back for follow-up.
Yeah, that's really interesting. So what led you from being a cardiac surgeon into specializing in this type of vein care?
Well, cardiovascular surgeons take care of not only hearts and lungs, but also the vascular system. And, I wanted to go out onto my own practice, stay here in Fort Wayne, and we developed some minimally invasive techniques that have really revolutionized the way we can take care of vein disease, and those have spread across the country and now have become more common.
You told me you've done 15,000 of these procedures?
That's true.
That's pretty remarkable. And you led a lot of the development in this techniques?
I won't say that we led the development. We were one of the early adopters of this type of technology, and we did develop some techniques that we've been able to teach to other physicians both around the country and around the world.
So we're going to talk about what that technology is, the procedure, and how it works. But first, let's talk more about the problem. We're all familiar, I think, with varicose veins, those large, often blue, ropey-looking veins that are at the surface of the legs. What's going on to cause that problem?
Well, our venous system, our veins are basically just pipes to get blood from our legs back up to our heart. They're beautifully designed with delicate little valves, one-way valves on the inside, that keep that blood moving upward and prevent gravity from drawing it back down into the legs. Usually, when someone has these ropey veins on the outside, there's a vein on the inside of the leg that's the culprit. The valve itself has broken down to the point where it's not preventing that downward flow. That pressure builds up, and it causes what we see at the surface as basically the tip of the iceberg, the varicose veins. But usually the problem is on the inside.
So what happens if I don't treat this?
Yeah, over time, what people find is, first of all, their symptoms continue to worsen, so pain, disability, swelling. But then the character of the skin down low can certainly change, and change permanently. It can darken, it can thicken, it can lose its ability to heal, and some of those people go on to have venous ulcers, which are very difficult to heal until the problem's solved.
So a venous ulcer, so the skin is broken open and there's an issue with that?
Continued sore that's very difficult to get healed, yes.
Who's at risk?
Well, I think, anyone who has veins is are at risk.
So all of us, yeah.
Right, but I think most people that we see have a genetic predisposition to this, a family history of this, a family member at some point who gave them a predisposition towards these valves failing, and it's a very common problem. Most often, though, you've taken that genetic predisposition and you've put it in an environment where it can flourish. So oftentimes you'll find ladies during pregnancy find that they're having problems with their venous system. Hairdressers, nurses, anyone who's on their feet for long periods of time, especially when they're immobile, can suffer from this. But, few of us are going to escape the ravages of gravity.
Yeah, that's a universal constant. I want to go back to the issue of what we're seeing on the outside is just the tip of the iceberg. So explain to me the mechanism of that internal vein causing the external problem.
Yeah, so if you think about veins as starting off as small little creeks that you might have in your backyard, and then eventually those creeks flow into larger rivers and then into the Mississippi, the Ohio, and then the Mississippi. That's what goes on with our venous system. So the small veins at the surface will drain into larger veins deeper, and if those deeper veins become incompetent, if the flow is reversing in those, well, that pressure will be transmitted to the surface into those surface veins, and they'll bulge.
Okay, so you are actually treating not necessarily, well, are you? I don't know, good question. Are you treating the surface veins and the internal vein both? Or are you fixing the internal vein and that resolves the external vein?
No, once these veins at the surface have been stretched out, they're stretched out almost like the collar of a shirt. You can let go of that collar, but it's not going to snap back down to normal. So most often we're treating both the internal and the external problem at the same time.
What kind of discomfort is involved in the process of going through this vein disease? How do my legs feel?
You're talking about before the
before,
procedure?
Right, yeah.
Yeah, the range of symptoms that people come to us with is fairly broad. Some people, it's just a swelling issue. Other people, that they find as they get out of bed, their legs feel heavy. Some people feel pain in the area of these larger veins. And some people have the skin changes and itching that are very, very common with vein disease. But, some of these problems do sound vague. And sometimes you don't know specifically whether it's varicose veins or some other issue until you can do some more conservative therapies with compression hose and see if they can, at least improve the symptoms to a certain degree.
So I can have pain and vein problems from that internal vein without the big ropey veins on the outside?
That's possible, absolutely.
Tell me how the compression stockings work.
So compression stockings are first of all, they've improved. So, aesthetically and from an efficacy standpoint, they're much better than they were for, the hose that your grandparents may have been using. But what they do is they have a higher pressure down low at the foot, and that pressure slowly dissipates as it goes up the leg. And so blood and fluid will be pushed preferentially from the higher pressure down low to the lower pressure up top. What that does is it takes a lot of the pressure off of the veins and it compresses them such that blood's not being forced down in the wrong direction.
Something else that's improved dramatically is the treatment itself. You told me you used the word barbaric in describing the old form of treatment. Let's talk about that.
Well, certainly when I was training, we did consider a lot of the vein treatments fairly barbaric. They were brutal operations. We were limited by the technology that we had, and we did things that we could to resolve people's symptoms, but we would wait until they had very severe symptoms, because oftentimes the treatment was worse than the disease. As technology improved with lasers and with ultrasounds that we could use precisely intraoperatively, we took open procedures that would have kept people off of work for weeks and had a hospital stay usually. And we've been able to make it so that these procedures can be done now through literally pinholes in an office, no sedation, just with local anesthesia, and people are back to work usually within a day or two.
And one of the points that I think we need to make here is there are a lot of places that you can receive vein therapy, but they're not necessarily vein specialists. Walk me through that.
Well, there are no regulations as to what a physician can call themselves. You can call yourself a vein specialist, but I think, in this town, if you're going to have open heart surgery, you can be guaranteed that it's going to be a board-certified cardiovascular surgeon who is going to do your procedure, and he's going to do it very, very well, because I know those people. I would encourage people, if they're going to have vein surgery, to have it done by a board-certified surgeon. I think if you're going to have vascular surgery done, it should be done hopefully by a vascular surgeon. I think seeking out somebody with qualifications, such as a general surgeon or cardiovascular surgeon, is important. Not only that, though, what kind of experience have they had? Have they done this thousands of times, or is this their first week trying this? And then, thirdly, I think results. Can you show me not a few before and after pictures that have a good result, but literally hundreds and thousands? Because if you can't, then your results probably aren't reproducible, and you may need to look for somebody who does have those qualifications.
So is there a quick screening question I should be asking?
I would ask what is your physician board certified in, and how many of these procedures has he done?
Okay, good point. Now, you said that the technology has come so far that we went from really gross and barbaric tactics to now pinhole level surgery. So let's walk through some of those things. And sclerotherapy is what type of procedure, and how does it work?
Yeah, sclerotherapy is the injection of an irritating solution within a vein that hopefully gets that vein to close down. It's most effective in quite small veins, spider veins that sometimes crop up on folks. The bigger the vein, the less effective sclerotherapy is.
And those veins are there for a reason. So if we're causing them to close down, what happens?
Well, we have hundreds of veins, first of all. These veins that are bulging and refluxing, the blood's moving in the improper direction, are actually not bringing blood out of your legs like they should. And so all of that extra blood coming down is having to find its way back out through healthy veins. Mm-hmm. So actually making these veins go away takes a lot of the work off of the healthy veins.
So sclerotherapy is applicable not only to the but also to spider veins, right?
Spider veins are usually treated by sclerotherapy, yeah.
So a quick little injection, and then how long till I see results, and what kind of discomfort and pain is associated with that?
That's something that people can do on their lunch hour. Usually a 20-minute session. Takes a couple months to see the final result.
So then the next step up in the chain is guided ultrasound sclerotherapy. Tell me about that.
Well, there are some veins that we can, straighter lengths of vein, that we can place a laser fiber within to close down, and we can do that through a pinhole. But there are some that are almost like a snake deep in the leg. And those are a little more difficult to treat with the laser because of the limitations of the maneuverability of the laser. So we can use ultrasound to place this irritating solution, this sclerosant, within the vein and get it to close down just like we would with the laser.
Got it. So saphenous vein ablation sounds pretty serious. Ablation means you're doing essentially the same thing, right? You're damaging the tissue and causing it to constrict?
Yeah, so the more serious we make a procedure sound, the more we can charge for it. But seriously, it's saphenous vein ablation is basically watching the saphenous vein, which lives an inch or two beneath the skin, making a pinhole over it, and with an ultrasound, guiding a laser fiber up it, turning the laser on, and slowly backing it out. You can do this if you're skilled with an ultrasound and local anesthetic techniques right in the office.
So are you using the ultrasound live to guide you, or is it taking an image and then just kind of remembering and getting that mental image of where that was?
You know, my initial meeting with the patient, I am making that image in my brain, but during the procedure, it's a live thing that I'm doing on the screen, the ultrasound screen.
So you're watching and making sure, I get it. So the ultrasound is guiding exactly where you place that.
Right. Some people would call it Nintendo surgery.
Okay, I got that, yeah. And are you able to actually see then blood flow stop to the ultrasound?
You don't see that. I mean, if I went back and looked, I certainly could. But what we're doing is irritating the vessel wall enough to get the vein to close over the next few days.
So what am I feeling during that procedure? You said it's local anesthetic, so nothing there, but immediately after, the hours, the days afterwards, do I notice a difference immediately?
Many people have called us the next day and said their leg already felt better. That being said, it's not a no discomfort procedure, especially where I laser the vein. People do feel discomfort, but they're doing normal activities. They're up, they're walking that day, and going back to work usually within a day or two.
And then a phlebectomy is what?
Phlebectomy just means taking out a portion of vein. We used to do this through large incisions up and down the leg, take the entirety of that varicose vein out. Now we can do this through little pinholes, take portions of the vein out, and that causes the portion in between to close, and we're allowing your body to dissolve it for us. We've found that the smaller the incision, the less the trauma we create, the fewer future vein problems that we stir up.
So I'm fascinated by the pinhole concept. So what are you actually inserting through that pinhole that allows you to do that?
There's a little hook, and I can, in my mind, it's a little bit delicate, but we're just teasing the vein out of that little hole and taking as much of it as we can get. Yeah.
And you don't need to put any type of a suture at the open end of the vein?
No, We've surrounded the vein with enough of an anesthetic solution, a dilute solution, that pushes the blood out of the vein, It also has a little bit of epinephrine to squeeze the vein down to get it to clamp down. And so there will be a little bit of bruising, but there's no sutures that are needed in the vein itself.
Oh, interesting. You may have to find a patient who will allow me to come in and observe that procedure sometime. That sounds pretty interesting.
I think you'd be more than welcome.
Oh, that'd be great. So if I have varicose veins in one leg, am I likely to have the same problem in the other leg?
Not necessarily. I think people look at their bodies, especially their limbs, and think they should be symmetrical. But what's going on the inside is asymmetrical. The biggest blood vessel, the biggest vein that we have inside our abdomen, the inferior vena cava, is not coming down the midline. It's actually off to the right. And so the pressures that the two legs see can be totally different. So very, very often, probably 50% of the time, somebody will come to us with vein disease on one side and a completely healthy leg on the other.
That's interesting. So let's talk a little bit more. We mentioned spider veins just in passing. And that is predominantly a cosmetic issue, right? Is there discomfort or anything associated with that?
Occasionally. I would say maybe 5 to 10% of the time, but mainly it's a cosmetic issue.
And then is insurance likely to cover that type of therapy?
No, they do not. Even when people are bleeding from their spider veins, insurance companies don't pay for them. Don't ask me to explain insurance companies.
Yeah, I understand that. But the other treatment they will, in fact, cover, correct?
Most insurance companies will pay for treatment of vein disease if the patient is symptomatic and they have tried conservative measures like compression hose in the past.
So walk me through that. I have to have tried compression hose for what period of time before our friends, using that word considerately, our friends in insurance are going to say, okay, that failed, and now I need to move forward?
Yeah, it depends on from insurance company to insurance company, but the range is 6 weeks to 3 months. There are a few insurance companies that realize that compression hose will not solve the problem. It will not make these varicose veins go away, and they don't put their members through that. But most insurance companies require a period of time with compression hose. Do
I need to see you at that point? Can I just go get compression hose somewhere, or do I have to document that you've had my ICD-10 code and it's in the chart, et cetera, et cetera, et cetera?
Certainly patients can buy their own compression hose. The quality of compression hose from different suppliers varies widely.
Okay. We have a text question. Heather, I'm going to bring you into the picture here to get this question in front of Dr. Jimenez.
All right. Health call help. I've had injections twice and stripping twice, but they're coming back. They took the sap genius vein and said they won't come back. I have a fair amount of bruising from all this stuff I've had done, too.
Okay. So I don't know where this patient was treated, and certainly they could have been treated completely appropriately. There's no question that people with a predisposition for vein disease can have recurrences in the future. I would say 2/3 of our patients never have any more problems. We never see them again. And 1/3 of our patients have meet us every 5, 6, 7 years. So recurrences are not impossible and are not an indication that the patient wasn't treated appropriately the first time.
So if they're still having discomfort, is it likely that it's that vein has progressed to another challenge, or is it if the vein is gone, it's gone?
Well, certainly we always ultrasound people afterwards to make sure that we got the job done. But we have hundreds of veins in our legs, and just because you fix one vein doesn't mean another one can't fail you in the future.
About 50 seconds left here. If I am having this problem and I want to see you, how long from my initial contact to you to kind of get an appointment, and then how long into treatment?
I have the greatest staff in the world. They like to work hard, and they will work with people's schedule to usually get them in to see us within a week or two.
Excellent. Okay, there you go. That is Dr. Marcus Jimenez from the Indiana Vein and Laser Center. You will find them online at indianavein.com. Offices on Engle Road here in Fort Wayne, also in Fishers, Indiana. And I invite you to reach them at indianavein.com.